New recommendations were announced today in San Francisco to reduce the number of newborns who die from sudden infant death syndrome, also known as SIDS. Well, joining us now to talk more about these new guidelines is KTVU medical expert Dr. Larry. Dr. Larry, thanks so much for joining us. First of all, Dr. Larry, let's talk a little bit about SIDS and just when it poses the greatest risk.
So SIDS is sudden infant death syndrome, and it is where children, especially at risk between 1 month and 1 year, die unexplained. So you run an autopsy, a bunch of tests, and we don't know why it happens. It's also called crib death. Often happens at sleep at night. So these new recommendations came. We're trying to figure out what can we do to prevent this. You know, at the point when it happens, there's nothing you can do, and so we want to do everything we can to prevent this.
Yeah, it's obviously scary for so many new parents. Let's get right to those new safe sleep guidelines. And the first one that is a big change is that parents should share a room with their child. Why is that?
So it's an association. Several studies have come out that we've looked at that have shown that when children are in the same room, and this is not the same bed, it's not bed sharing, which in general we don't recommend in that age. But when they're in the same room, it seems that that is associated with a lower risk of sudden infant death syndrome. So that is something you can do to lower that risk.
As you mentioned, though, not in the same bed, they recommend that an infant be in a crib or a bassinet. It's important for them to have their own sleep space.
Right. I mean, when they're in the same bed, especially if they're under the covers, that can kind of increase the risk of, again, we don't know exactly what happens with this, but there's all these factors that are associated with it. In the early 90s, 92, pediatricians came out and said, this is when we really emphasized sleeping on the back. And that seemed to make a difference. It brought the rate from 1 in 1,000 down to about half in 1,000, reducing it about 50%. I'm sure pediatricians are hopeful that issuing this statement will further drive that down, to prevent what is the #1 cause of death in children between, again, 1 month and 1 year of age.
Yeah, some of the other recommendations obviously put the child on a firm surface, make sure it has a tight-fitting sheet, keep soft bedding, including crib bumpers, blankets, pillows, soft toys out of the crib. I mean, that all sort of makes sense, right?
Yeah, I mean, if you think about it, we kind of lump some of these other things together, and when kids die in sleep, anything that could potentially, asphyxiate them or suffocate them, you want that stuff out of the bed and kind of clear for them so that they're just kind of sleeping comfortable, again, like you said, on a firm surface. And this is kind of the limits of what we know. So the things that we do know from research, we want to make sure that that's emphasized. And again, now the new one is this room sharing where they're in the same room.
Yeah, and Dr. Larry, you mentioned the reduction in the number of children affected by SIDS. They're hoping that these new recommendations will actually lower that risk by as much as 50%.
Yeah, so in 2014, the last year where we have numbers, 1,400 children died of SIDS. That's not an insignificant number. Again, it is small, 1 in 1,000, but since that is the #1 kind of risk of your child between 1 month and 1 year, this is why this stuff is significant.
Yeah. All right, Dr. Larry, thanks so much for taking the time to talk to us. Let's hope all the parents out there take these recommendations to heart. Appreciate it.
Thanks, Heather.